Hi, it's Dr. Splickle. We're going to go over how to do your foot impression so that I can make accurate custom orthotics for you. So you should have received this foam art box, and what you're going to do is you will open it up, and if inside you happen to notice that there is the piece of paper, which is the prescription, I'm going to have you take that out carefully, set that to the side, try not to make any sort of irritation to the foam, and then we're going to be making our foot impression. So you want to have a seat in a chair so that you can find a nice 90-degree angle with your knees to your ankle. We're going to be doing 1 foot impression at a time. So you're going to take the box, set it down on the floor, and then you're going to lift the side of the box that we're going to take the impression of. Now again, you want to take that impression with your foot directly 90 degrees beneath your knee. The opposite leg you can have out to the side, you could step to the side, but try not to have that throw off the impression. We're then going to put our foot on top of the foam, but do not push down yet. What you want to try to do is to keep your foot in what's called a neutral position. So if I was helping you do the impression, I would have my hand and it would just go just underneath the ankle bone so I can hold my foot in what's called neutral. You're then going to take the opposite hand and you're going to start to push the toes down into the ground. You're not pushing your foot down, you're taking your hand to push the foot down. My right hand is still locking my foot in neutral. I'm going straight down, and you want to go about 1/2 inch down. That depth will give the lab a good foot mold. Once you have it about 1/2 inch down, you're going to release your hand and you'll lift your foot straight up out of the foam. That side is complete, and then we will go to the other side. So right now I'm going to my left side. My right foot I'm going to keep back. Left foot I'm going to put directly onto the foam, have my knee directly over my ankle. My left hand is going to grab just underneath my right ankle bone and is going to rotate the foot a little bit neutral. That is locking neutral. My opposite hand again is going to push down into the foam and then push the heel down. And again, you want to be about 1/2 inch, maybe 3/4 inch down. Do not go the full depth of the foam. We're getting a good impression of our foot, hand staying in neutral, and then you're going to lift straight up. So what you'll end up seeing in the foam box is going to be an impression of your feet that looks like this. Again, that's about 1/2 inch or 3/4 inch straight down. Once you have that, you're going to carefully take the prescription, if that was what was sent to you from me. It'll go into the box, simply seal the box, and then you will ship it to the label or the address that is provided to you. If you have any questions, do not hesitate to reach out, scheduling at dremilyspickle.com or 917-825-4297. Thank you so much, and I appreciate your order of your custom orthotics.